Africa is now almost 15 million. That's close to 37% of the population over 18. As COVID-19 infections continue to climb, especially in Gauteng. Let's check in now with Dr. Ahluwalia from the High Health on how universities have been coping. A very good afternoon to you, Doctor. Thanks so very much for joining us and availing yourself to SABC News as always.
Good afternoon, and it's absolutely an honor. Thank you.
Doctor, COVID-19 numbers are increasing quite rapidly in Gauteng. Let's talk about measures that are in place to ensure the safety of students at places of higher learning. I do note, I heard on the radio, of course, yesterday that the University of Johannesburg is one of the latest universities now to be joining the mandatory vaccine drive. And I'd really like to know how much this is going to assist in the universities. And is there going to be some sort of pushback? Because now we're fighting, the right of people who are saying, look, I don't want to. And also on the other end, you're fighting the issue of education and right to education and being on the premises to get an education. I mean, how will this all be working out?
So thank you very much. There are basically, just to start with your first question before I move to the universities, very quickly, there are four key variables that are driving our fourth wave. And now the fourth wave, the new variant has clearly expressed itself to be extremely highly transmissible. The early data that now is about 1.5 weeks with us is clearly defining a situation where we predicted it in the past, but we actually know what we are dealing with in current scenario. So the COVID variant, which is Omicron, which is highly transmissible, has become a dominant variant and has now spread to all the provinces and formed a community spread, is clearly one of the biggest defining variable that we are all watching in place. But the three other variables that's actually defining our real fourth wave is youth, which is young students and young people, because the early trends have clearly shown the variant was highly showing affinity to young people. It's because it's highly transmissible, it moves from one body to the other, and young people have been transmitting this virus quite enormously. And the second reason is behavior. The reality is we have let our guard down. This virus is still an airborne disease. It still is the same variant. It's highly transmissible variant. It has modified, it's mutated, but it still spreads the same way, which means things which we always advocated like masks, social distancing, still are very preventive and still will make a difference. And that lowering of guard has actually led to another second variable adding into it. And the third one is vaccination. And if you look at the three other variables, young people, not vaccinated, and also lowering their guard down or behavior is leading to what we are experiencing currently in South Africa. So at this moment, institutions of higher learning eventually become a significant role player or a factor. The actual reality is we picked up the new variant at a cluster outbreak in one of our universities, because obviously when the cases were very static, it was about 200 cases a day, and suddenly you see a huge COVID cluster outbreak with so many people becoming positive in a congregational setting, you start seeing there's something unusual happening. The reality is 60 to 70% of South Africans had something called natural immunity because they got infected with COVID during the first wave, the second wave, or the third wave, which means immunity was there. So we have to look at a variable or a defining new variant that's kind of escaping immunity, which means the waning immunity of our natural immunity is being now cracked down by this new variant, and reinfections are really possible. And that defined how young people, how congregation, how institutions of higher learning came to be in a very center focus towards curtailing this fourth wave.
In the new year, are we looking towards perhaps having more online lectures? Because as it stands right now, we're at a point where even the vaccinated can still, in fact, get infected by COVID-19, and certainly with all these variants that keep coming up, nobody essentially is really that safe. So would that perhaps be a feasible option and an option available and open to those who may be, hesitant instead of blocking them off from being able to access university education altogether?
So this has been the norm currently. If you look at our system currently, in fact, when we talk about higher education in total, we're not talking just about universities. We've got another 1 million young people in community education, in technical and vocational education and training colleges together. So you're looking at the entire system and how we're going to be working towards opening the system. And when even vaccines were not available, which was as early as July 2020, which was last year, we actually had to open our institutions for contact learning. You can't teach plumbing, mining, electrical, medicine completely online. As much as hybrid mechanisms are very important, but you cannot take away something called contact learning. So the protocol are established, the systems that were built. We issue a daily passport on a toll-free health check application, which does not need a smartphone. It just needs a device, and you can actually do your symptom screening, and you are issued a daily passport, so that there's no congestion at the gates. So the institutions, irrespective of how the levels of our vaccination rates will still open institutions as planned in the 2022 academic year. What will still happen is the hybrid mechanism. The question is, can we get our population vaccinated? Because now what vaccination doing is, clearly even in the fourth wave from the early data we are seeing, that yes, reinfections are happening, but vaccines are preventing hospitalizations, vaccines are preventing severity of the infection. Vaccines are even preventing death. And because you have a vaccine, the vaccine will somehow, even if the virus enters your body, because virus doesn't know whether you have vaccine or not. Virus is moving, it's transmitting from one person to the other. But as soon as the virus enters your body, it starts binding to the cell and starts replicating. We call it as viral load. But when vaccine immunity is already there, it immediately suppresses the viral load, which means your chances of transmitting the virus is less compared to anybody else who's non-vaccinated. So there is definitely vaccine which is preventing not only severity of infection, but also are helping in reducing viral loads and transmissibility at times. So we're keeping that data in mind. Things are into grounds around how much rates of our student vaccination will be by the middle of January, allowing our institutions to start considering something called how stretching from the hybrid contact learning and open learning systems, can we now move from what we had 50% contact learning and 70% online learning to a reversal called 70% contact learning and 30% online learning. Because at the end, our institutions are built for contact learning, and we cannot take away the contact learning. And that's why the questions of regulations, questions on consultation of regulations now becoming pertinent, keeping the science in picture and keeping our business continuity in mind.
Yeah. Dr. Ahluwalia, one of the things that came up this week was the fact that less affluent institutions of higher learning, pardon me, I can't seem to remember which varsity it was this week, that complained about the fact that they were not given enough tools to in fact be able to adhere to COVID-19 protocols, whether it means that there's not enough, whether it's PPE or whether it's sanitized, whatever it was. But the fact was that they were basically saying that government didn't seem to care when it came to them being able to guard against COVID-19 in those institutions of higher learning that seem to be less affluent. What would you say to that? Does that seem to be something that you're hearing quite a lot of? And again, I am specifically talking about those universities and institutions of higher learning that may be less affluent.
In fact, I don't know about this, because we have even more disadvantaged institutions called the technical and vocational colleges, even community education colleges, which are more disadvantaged and more in rural areas or in peri-urban or informal settlements in predominance. Yeah. And the protocol, the guidelines, the system strengthening are applicable to everyone. So I think I'm not aware of which are those institutions, and I will look into it.
Yeah,
it has not been brought to
Yeah, no, I was
and
just
to
saying,
my office.
yeah, I was just saying, please do. I'll certainly also find it for you. I certainly was on air when that story came up, and it is something that has been raised as a concern. But generally, just looking at our universities, and it comes to adherence of protocols. I think you were carrying on that particular topic.
Yes. So the point is, we have released as early as April, May last year, not only the policy and guidelines on the COVID-19, and I know these are some terminology, but there are minimum standards of checklists, there are protocols that have been established. So right from, so we have actually capacitated close to about 56,000 frontline workers and student volunteers who are actually deployed in the institutions of higher learning to keep on ensuring that the protocols are followed. So protocols go as deep as residences, private accommodations that we have. We're trying to capacitate resident wardens, house mothers, and we've established quarantine and isolation facilities, exactly how the cluster outbreak in TUT started, which led to us the fourth wave. I mean, the start of the fourth wave happened from a cluster outbreak. The question was how quickly the protocol kicks into contact tracing, putting the students into early quarantine and early isolation, so that we can break the chain of the transmission very quickly, so that the spread can be quickly curtailed down. So these are the types of protocols and checklists which have been capacitated to people who are running simple systems or complex systems in our institutions, like the residences or classroom activities. And similar protocols, what do you do when one student becomes positive, to as high as about 500 to 1,000 people becoming positive. We've seen that. It's not usual for us, which we can say it didn't happen in the second wave or in the third wave. We had campuses or residences where we had 500 plus students who turned to become positive at the same time. And they had to be managed, they had to be balanced, and they had to be put very closely work with them. We have developed what we call a provincial and institutional cluster outbreak teams, because we do see young people congregation leading to cluster outbreaks at a very quick pace, and it spreads very quickly. So these are measures and systems built for infrastructural development to deal with COVID. And obviously now the question on protocols and ventilation, invigilation of exams, and we have actually conducted this year over 1.2 million students of exams in contact, which has been done through proper regulatory protocols. So this will be the norm next year. But the question is how the high transmissibility virus, and with the early data remains, still early days, but seems to be less virulent compared to the past, makes us more confident if we move with the following science into the next year, will give us more confidence to say, how more can we now open our contact learning for more contact systems than completely keeping it in online systems.
All right. Dr. Ahluwalia, it's always a pleasure having you on the show. Thanks very much for all your information. Certainly, please do look into that story that I did raise at this time. Thank you very much, sir. All right, that is Dr. Ramnik Ahluwalia from higher education, higher health, speaking to us on how institutions of higher learning are coping with the new strain of COVID-19. Well, today is the last day for the Vuma vaccination weekend as part of